Hi, this is LILIAN Miranda, and this is my research paper on adult daycare centers. To determine the need of an adult daycare, it's good to learn the demographics of the communities. The dark green areas determine 65 and older percentages in the south coast of Florida. As you see in the map, to start an adult daycare center where there's a lot of retired. To know more about adult daycare centers, you can contact the local area agency on aging. Also, what specific services are important to your participants? Determine what is their need. What social activities will you offer? Assisting with daily living, therapies, health monitoring, nutritious meals, exercise programs, or special care. Good advice. Join the National Adult Day Service Association. You can save money on training and resources. System development cycle. Assessing business needs. 3 major factors to determine where to allocate funding for development: return on investments, competitive advantage, or risk management security. Basic services in adult daycare can offer are a protective environment that promotes a non-institutional atmosphere where supervision for the health, safety, and well-being of adults who have functional impairment. Offer a variety of therapeutic social health activities services to help restore, remediate, or maintain optimal functioning to the participants and to increase interactions with each other. Offer leisure time activities for participants, programs designed to assist participants' self-expression, enhance self-esteem, provide mental stimulation, and social participation. Nutrition services. Participants attending a center for 4 or more hours daily shall be served a meal. Prepare a standardized recipe, which you could look this up in the Dietary Department of Elders, and they could send you a list of all the recommended nutritious meals you may provide. Schedule meals 3 hours before the noon meal or 2 hours after the noon meal. Must be provided a snack to all the participants. Develop work assignments, purchase food, training, and supervise food service employees. Resources and funds are provided by Medicare and Medicaid participants, or also who are disabled or have Part C. Administration and staffing. Operators may own 5 facilities, assign governing authority, select staff registered nurses, therapists, drivers, volunteers, develop a training plan, job duties and responsibilities, discover contracts, discover stakeholders, create an emergency plan, and ensure privacy and free from abuse center. Adult daycare centers are licensed under the Part 3 of Chapter 429 Florida Statutes. Training requirements shall complete the required initial 1-hour training and should be completed once only for each applicable employee. Participants' care standards. Maintain standards free from abuse. Program requirements. Offer a planned program with many activities. Describe services provided to members. Comply with Medicaid waivers. Comply with all provisions of the program and Medicaid waivers requirements. Emergency Management Plan. Provide programs and information for awareness of the factors related to emergency preparedness. Some implications of having a functional limitation in a disaster. Emergency Management Plan. There are provisions for disasters and emergencies in an adult daycare. Preparation to notify family, secure the center, secure supplies, staff, and emergency equipment. Review plan annually and submit to the emergency agency. Conduct a fire drill to staff once a month and every 3 months for participants. Program data. The owner should approve each participant file and care plan. Establish, maintain, and ready available to disclose immediate use to ACA, Agency for Healthcare Administration. Complete accurate social, medical, and fiscal records which fully disclose the extent of services to be maintained by the center required by state and federal law. Update file quarterly or when a change occurs. Optional support services. In addition to basic services, you may add additional services to the adult daycare as nursing and social services available for 5 hours and 5 days per week, excluding holidays as posted by center. Fiscal standards is to maintain records of all funds in the trust, furnish annually to all the participants details of the usage of your funds, maintain liability, and advise of any changes. Center standards. All centers receiving federal funds shall meet regulations for access to the handicapped in compliance with Americans with Disabilities Act of 1990. Capacity shall be determined by the total amount net floor space for participants.